Good morning. Hello. My name is Marina and I am a physiotherapist. I work in the west of Scotland with children and adults with neuromuscular conditions, and a large part of what I do is with adults who have Duchenne Muscular Dystrophy. Now, I don't have any slides this morning because what I'm hoping to do is to make it more of a practical session to show you, and I'm hoping that I'll have a model who doesn't mind me taking them through some of the passive movements and passive stretches. I can see you all kind of going, oh, but no, it'll be fine. I do an adult clinic 2 afternoons a week, and during the clinic, the sort of things I am asked, the sort of things I'm looking at is I want to find out how, as young men, you are coping with your condition. I want to know if you're having any pain. If you are having pain, when do you have pain? Is it in the morning? Is it in the evening? Is it as the day goes on? Is the pain all over? Do you have trigger points? If you have trigger points, it's very often to do with the way that you are sitting. If you are sitting in the same position all day, you might have had a spinal fusion. As time goes on, we start to see low back pain because your back is being held in a very straight position, but the pain can build up in the bottom of your back, for example, as the day goes on. So we would be looking at changes in position. So we want to find out all about what we would call your pain profile, how long the pain lasts when you're having pain. Is it when you wake up in the morning? Could it be to do with your position that you're lying in overnight? Are you managing to be turned through the night or being moved through the night? It doesn't necessarily have to be a turn onto your side. It might just mean that you need repositioned. Do you have a sleep system in place? A good mattress that you are having good pressure redistribution? Are your arms and legs being supported through the night? Because as you fall asleep, everything relaxes, and you can sometimes go into an awkward position that you might not be able to move out of. So are you waking up at night? That's one of the big questions. If you do not have a good night's sleep, then your pain profile will increase. Your pain will be worse through the day. So we want to make sure that you are having a good night's sleep. If you're waking up through the night or if you're not getting to sleep, you've already heard a talk about sleep, about looking at the initial sleep phase, how you get off to sleep. Are you waking up in the middle of the night, the intermediate sleep phase, and why is that? Or are you waking up too early? We want to kind of find out how you're sleeping. We want to find out what your pain is like, and we want to find out about your movement throughout the day. So those are the 3 big areas that I would look at. Usually, once we've kind of sorted out your sleep management, and we would look at that management over the 24-hour period, not just what's happening in bed, but we would look at your postural management and sitting in the wheelchair. What kind of chair are you in? Are you in a chair that tilts back? So you've got a tilting space on your chair. And by that, if you're sitting upright all day, gravity is pulling down through your back. You are getting more pressure building up around the pelvic area. If you tilt back like that, suddenly gravity isn't pulling straight down, but it's acting through the whole of your back. You're redistributing the pressure. So just by changing your position, by tilting back, you are helping with your pain management. So we would look in to see what kind of chair you're sitting in. Do you have a chair that reclines? So some people will have a tilting chair. Some people, the chair will actually recline. And if the chair reclines as well, it means that you can get your clothing altered. You can get a bit of a move around. Some people have lie flat chairs so that they can have a move about through the day as well. So we're looking to ensure that your postural management is absolutely adequate. If you don't have the internal support, so your muscles are weaker, we have to look at that support coming externally, and that's why it has to be good postural management. So we have to make sure that your chair is a good enough chair to help you change your position throughout the day. Movement is one of the biggest areas, and movement is so important because we all need to put our joints through their full range of movement every day. If your joints are moving all the way up, all the way out, your elbows are moving, your fingers are moving, your knees, your hips. If you are moving, you are helping your joints become healthier. You're maintaining the health of your joints. If you don't move, you are not producing synovial fluid, which is a fluid that surrounds the joints. So if this is your hip, this is the socket, this is your femur. If you're not moving, if you're only moving little bits like that, you're not moving your joint through the full range of movement. Therefore, your joint is not getting fully, it's not having enough of the synovial fluid, it's not having enough nutrition. It needs to be moved. Our joints need to move. There's been a lot of research done on patients who are in intensive care for long periods of time, and these are patients who develop problems long term. They might develop problems with pain, they might develop problems with their muscle. If you are moving or someone is helping you move through your full range of movement, you're not just looking after your muscle, but you're looking after your joints as well. So movement is very important. We used to think long ago that you got osteoarthritis if you were very old, or if you were a gymnast or an athlete and you were constantly moving your joints. We also see that now in young people who are not being able to move their joints. They are developing osteoarthritis, which is very painful. So we need to look after your joints, and the way that we look after joints is through movement. The way that we look after muscles is through movement. If you can't take your joints to the full range of movement, and we get help that you could do that, either with a carer, we have Motomed machines, different kinds of things that can help you do that. If you're able to take your joints right to the very end of range, you're really putting your muscle through its full range of movement. Your muscle releases substances called myokines, and myokines are they're released in different ways. So if you're lifting something heavy, it will be a different cluster of myokines that are released from when you're doing something passively. But these myokines help your immune system. They help with your bones. They help look after the health of your bones. I cannot stress enough how important movement is, but that's something that we often see is becoming less as we grow into the adults with Duchenne. So as a child, you might have been very active being playing, but somehow when you become older, you're maybe in a chair for most of the day, it's not perceived by other people to be as important, but it absolutely is if you're wanting to look after your long-term health. So at my adult clinic, I always look at 24-hour postural management. The way that you sleep, the way that you sit, and the transitions in between that. Often people will say to me, it's funny, but it's only when I'm being moved I start to notice I'm a bit stiff, I get a bit sore. So when I'm up in the hoist and I'm being, hoisted out of bed into the chair, I can suddenly get a bit of an ache in my hips or in my back. And that's because you've been lying in the same position for a long period of time, and then your muscles become stiff, the circulation slows down. So you get a stiffness, a pain when you're being moved. Once you're up and about, you feel better, the circulation is going. I don't know, is that anything that anybody can relate to? I don't know, Mark, or I don't know everybody's. Yeah, do you see that it's during the transition periods it can be sore in a hoist and things like that? Sorry, Mark?
My hips almost hurt when I get lifted in the hoist.
Yes, okay. Well, that's an interesting one as well, because if it's not actually during the lift, but when you're sitting in the hoist, I would say to you, we need to look at the position that you're in the hoist as well. It might be that a different sling, because some slings your knees can be up at your chest, you can be very flexed in. Some slings you're a bit more extended in. So it's looking at the sling, the equipment that you're using as well. So there's lots of different reasons that you can have pain, or you can have aches, or that you need to address the actual equipment that's being used. Okay, so postural management is one area, and the next area is movement. So I thought this morning what I would do is, people often say to me, I don't know how often I should be moving the arms and the legs, I'm not quite sure what I should be doing. So I thought if someone didn't mind, I would actually take you through the kind of movements that I would do and that I would teach to carers, to parents, whoever is helping that person move throughout the day. The movements don't take long, and you don't have to do them all together. So some people might, for example, have their legs moved first thing in the morning before they get up. It's a way of warming up, of getting the circulation flowing around their body before they get into their chair. It's not just for the muscles and the joints and the bones, but the other thing about moving your legs is if you are having your knee brought up quite high into your chest like that, you're increasing the intra-abdominal pressure, and that helps move the bowel, that helps with having everything go through you, helps with your digestion. So we think about increasing intra-abdominal pressure through movement. It also, if you are moving the arms about, you're changing the pressures in the lungs as well, so it helps with breathing. So movement is really important for all of your body systems. Okay, would somebody like to come forward and let me move their arm or their leg, or both? Well, I don't know if Mark is thinking about it. Do you want to come out? Right, okay, it's all right, we've got somebody, but I might even change you around, okay? Were you going to come forward, Mark? Were you thinking about that? No? Right, okay.
Sorry, can I have a question?
Yeah?
I come from Hungary, so would it be okay for me to take a video so that I can show?
Is this being streamed anyway? So it will be recorded, is it? Yeah. Okay. Okay, so you'll get that anyway. Okay. All righty. Thank you for agreeing. Okay, so if you want to sit here. You might want to move around a little bit so you can see this a little bit easier. Would you mind taking off your shoe? Is that okay? You see, now, she didn't realise she was going to have to undress. I know. She's telling me that you've got smelly feet. Okay. Thank you for that. So what I would start off with doing is I would be down, and I always start off at the toes, and it's just to kind of get everything moving. Also, if you've not been used to being touched for a long time, you can be a little bit nervous about how far you are going to be moved. And I would say, you start off very slowly. So when I'm teaching carers how to do this, I always say we start off very slowly. I always have the foot on top of my knee. Now, if there is contractures and you can't get the foot on top of your knee, you might want to come down. You might want to just even be down here, okay? So it's what's comfortable for the person. If there's contractures at the knee and they can't get the foot up high, just start off down low. It doesn't matter where you start, because what we're looking at here is the actual movement itself. Starting off with the toes, I would have one hand underneath the toes, and all I'm doing is I'm going to start off, and I don't want you to move, okay? I want you to be really relaxed. Just big breath in, just relax. Okay, so I'm just starting off very gently, small movements, and then we start to progress, okay? So we start off quite small, and then we start to get bigger movements. Now you're moving within the young man's own range, okay? So if he only has that amount of movement, that's perfect, that's all right. That's all you're needing to do. If you've got a lot of movement, and you've got a lot of movement here on your toes, you want to go right to the end of range, okay? So if you have that much movement, but you're only moving like that, you're not really doing very much. You have to move right to the end of range so that the joints are moving fully over each other, but also so that the muscles are stretching and relaxing. As our muscles contract and relax, the muscle fibers move across each other, and that movement across is where we start to see the muscle health, the myokines being released. We see we're maintaining the muscle memory of how far apart the muscle can move. If you don't move to the end of range, as physiotherapists, we always say, if you don't use it, you lose it. So you will lose the ability to go right to the very end of range. So we're moving right through that full range. I start off slowly, okay? And then I start to do bigger movements until I've got right to the end of range. And I do them fairly quickly. And the reason, now if you have a condition like cerebral palsy, for example, where muscle tone is an issue, you would always move slowly. Muscle tone is not an issue in muscular dystrophy. So we want to be able to do it fairly briskly so that we are really working the circulation and you're getting everything moving, okay? I tend to do each joint round about 25 times. So round about a minute each joint. I don't ever count because usually you're chatting away, you are, there's things happening, so you don't really need to count. The person who you are moving will tell you. And when I'm training carers, the thing that will often come back, I usually go out about 3 months later to see how everybody's getting on. And usually what I'm told is, they don't move me right to the end, they're frightened, they hurt me. The young man will tell you. if you are hurting them, believe me. So you would say, wouldn't you? If it was sore, you would say, whoa, you're going to be a bit too hard. So you are always in control of that movement, but I can tell you now, it's usually not enough. So toes, and then I would move on to ankles. So I'm holding, what I tend to do actually is use my leg. To actually hold a leg, it can be quite heavy. So then I would move on to ankles, and I'm just going up and down, up and down. And again, starting off fairly easily, and then I'm starting to do bigger movements, okay? So all the way through the movement. All the way through. So going up and down. And then I would go round. So round one way, and then round the other. So each of these round about 25 times. So 25 times up and down, and then 25 times of circles, okay? So that's toes, ankles. From here, I would move on to the knee. So to do the knee, I tend to use my leg for this, okay? So foot is placed on my knee, and then I'm moving up and down, okay? So I'm taking the knee in and out. Is that all right? I always say as well, have a wee look. Make sure that you're making eye contact with the person so that they can tell you. If you're away and they're kind of screwing their face up while if you're watching telly while you're doing it, it's not a good idea. So you really want to move in and out, okay? It's probably easier to do, I was going to say maybe in the bed, but actually you might get more movement in the bed with the knee because just now the chair is actually stopping me. But again, if you're doing it in the chair through the day, you might do a little bit more movement in the morning. It's what you're doing. I always talk about the 80-20 rule. It's what you do the majority of the time. So if you're doing it every so often and you're doing it 5-6 times a week, you're doing well. From here, moving into the hip, and I would move the hip up and down. So similar movement, but the knee is going higher, and you're going as high into the chest as you can. It usually, we start off, and then, you'll start to see, and Mark, if your hips are sore, then again, getting a little bit of movement around your hips would help look after your hip joints. People always think that if they're sore, not to move the joint, but in actual fact, unless there is a reason, unless there's a fracture and you want to actually immobilize a bone, it's usually the opposite. Moving in and out, okay? So there's different movements. So the hip goes up and down, it goes in and out, and we also have rotation at the hip. So that would be like that, okay? My hip clicks as well, right? So don't worry about clicks. Is it sore when it clicks?
No, it just makes
a noise, yeah. It's fine. If it was sore when it clicks, again, that would be a trigger for me. I would be thinking, okay, we might need to get an x-ray, we might need to refer you to orthopedics, we might need to want to know why there's pain there. Most people have clicky joints, and if it's not sore, it's fine, okay? So, that was flexion and extension of the toes. It was dorsiflexion, plantar flexion of the ankle. It was rotation of the ankle. It was knee flexion and extension. And then we had hip flexion and extension, hip abduction and adduction, and then we had rotation. Okay? So that was all the movements for the leg, and we would do it. Sometimes, if there's two people, we actually do it together. So as I'm going up, the other person's going down. It's like cycling. And we do it in coordination. And some of my patients actually really like that. They feel as if, God, I feel as if I've really had a bit of a workout. It feels really good. So that's good. The other thing that's also good for your muscles is massage. So if you feel that, it speeds up the circulation, the actual movement of the muscle, the kneading of the muscle, it's good for your muscles as well. So I would say that's a good thing to do. So then moving on to the arms, I would start off, and again, just by bending the fingers in and out. If you have tight fingers, yesterday when I was speaking about physiotherapy, we were talking about stretching, and the way that we do stretching in 4 ways. We do active stretching, which would be you stretching out as far as you can. So if you stretch your fingers out for me as far as you can, that would be an active stretch of your fingers. A passive stretch is when I would take it beyond what the muscle can do. So I would move your fingers back a bit like that, Okay, can you feel that? Or it would move your wrist as well.
Yeah.
That's a nice stretch of your fingers and wrist. You can't do that under your own steam. You need a bit of a help to do it. That would be a passive stretch. A progressive stretch is when you are maybe working the fingers. The fingers might be a bit tight, and many of our boys do have tight hands and tight fingers because you're using your joystick all the time. So taking you to the end of range, a wee stretch, few more movements, and to progress it, I would take it a little bit further into that range so that you're really feeling that. And in order for a stretch to be appropriate, for it to work, for it to be effective, you have to feel it. If you don't feel the muscles stretching, if you don't feel that discomfort, you're not stretching. It doesn't make any odds. So active stretching, passive stretching, progressive stretching, and the last form of stretching is static stretching. So often with my adults, if they have very tight fingers, we would look at orthotics and ask orthotics to make hand splints so that their hand is being supported in a splint, being stretched, and maybe you could sit like that with one on for an hour, 2 hours if possible, change over to the other side. Okay, so if you're watching TV or something like that, then you could sit with a splint on one hand, and that's getting a right good stretch over a period of time. So, fingers, thumb, across and back. Okay. Wrist, up and down. Do that 25 times. So I'm always supporting above the joint that I'm moving. Okay. And then I would just give it a wee stretch at the end. Wrist in and out. Okay. So that's medial and ulnar deviation, we would call that one. And then as if you're shaking hands, keeping the elbow bent, you're turning over and across. Did you say you do that? Do you like getting that done? Yeah, I know. Do you know, it's interesting because I work with, I've always worked with children and adults with Duchenne Muscular Dystrophy. And round about the age of, you know, once they get into secondary school, I don't know if this is the same, if you can identify with this, maybe the boys in the room will tell me, but from about 14 to about 17, it was like, don't want my stretches, can't be bothered, don't want to do it. Suddenly, they leave the adult services and they're saying, oh yeah, I want to be moved. Yeah, you can identify with that. I think it's just that all of a sudden you realise, actually, it did feel quite nice. So this over and back, and then I'm going to take the elbow up and down. Okay, so I'm moving the elbow. And then I'm going to take the arm out and in. And you can see I'm kind of moving my body as I do this, because you need, as a carer, as a parent, you need to look after your own back. And if you're standing doing this, you're going to end up with a sore back. So you really want to make sure you're looking after your own posture as you do that. So arm in and out. And then I would go the whole way up as far as you can. Okay? If you can get to there, that's okay. But as far as you can. And back down. And the reason we're going all the way up into elevation like that is this looks after the muscles around the upper back and the upper shoulders. And these are the muscles that are accessory muscles for breathing as well. So these look after our respiration. If we start to get tight around the chest and tight around the shoulders, that can also make you a little bit more tired by the end of the day. So we really want to make sure that we're looking after these muscles that look after the rib cage and the chest as well. Okay, so all the way up. So that was fingers, flexion and extension. That was the thumb across the hand and back. The wrist up and down. The wrist across and back. Supination and pronation. This one but you need to keep a bent elbow for that one. Okay. Elbow flexion and extension. Abduction of the shoulder. And then flexion into elevation. Okay? Does anybody have any questions? Does anybody want to ask me anything about that? Thank you so much. Thank you. Does anybody have?
I've just got a question, but
Yeah?
when I stretch my arm into elevation, like you just did,
Uh-huh.
if I push it, I find the next day it gets really sore. Does that mean I should do it more, or should I just be more gradual?
What I would say is do it more gradually. So if you find that you have done some passive movements and the next day you're feeling sore, you've actually moved, you've done a bit too much. You haven't prepared your body for that full movement. So it might be that you haven't done it for a wee while and you've got a bit stiffer and suddenly you're going all the way back up. You need to build into it. So you need to take yourself up to where that feels comfortable. And then perhaps the following day. But it's all about consistency as well, John. If you do this, we always say the 80-20 rule. So if you're doing it 80% of your week, so if you do it 5 days out of 7, that will really help. Okay? So you just need to just take it back, but then gradually build back into it again. And if you're doing it on a regular basis, you'll get that movement back again. Okay? Any other questions? Sorry.
Both of my sons have had Achilles tendon surgery. My youngest is sorted now, but my eldest son is very hypersensitive.
Okay.
I keep reinforcing I need to touch, I need to massage, and obviously you need to look at what I'm doing. But have you got any other advice about what I might need to do?
Do you know, that is, what age is he, if you don't mind me asking? 17, okay. That's one of our biggest challenges at clinic is after they've had TA surgery. So they might have had lengthening, and after that you can become... Some of the boys are hypersensitive anyway. They're hypersensitive before that happens. And that can be very challenging. But everything you're doing is exactly right. So it's a case of just, you have to keep touching, and it can feel... I don't know if any of you have ever had surgery, and perhaps after the surgery you feel a bit, you know, if you've had... Yeah, it can be it can feel a bit funny when you're touching it. Sometimes that's what happens around the feet area. But it's important that you do. Sometimes I say, is it easier if I keep your socks on while we're doing it, or take the socks off? So it's looking for, and also rather than hands on, hands off, it's maintaining that touch to allow the nerve endings to send the right messages back, that it's the constant pressure. So sometimes if it's very light pressure, it's worse, or if you're taking your hands on and off all the time, it's worse. But movement is really important.
So to try and put him through his full range
Yeah.
as much as he can tolerate.
Yeah. Is he standing or is he wheelchair? Right, okay, okay. Does he wear splints during the day in his wheelchair?
Well, we've currently got like sheepskin lined ones because he's waiting for his day splits.
Okay, that's fine.
He'll wear the day splits and the night splits.
Excellent.
We've had some advice from an orthotist to say
Excellent.
he doesn't necessarily need to wear the splints all the time, which is when we come into the arguments about positioning,
Okay.
seating,
Okay.
and it's all well and good saying this is what you should do.
Yeah.
But sometimes your local services are just...
I know, and particularly in adults. Uh-huh.
You're talking about adult physiotherapy. There is not
Yeah.
really. I'm trying to challenge that.
There actually isn't very much adult physiotherapy where I am. I'm the only adult physiotherapist for the west of Scotland. So I would try and basically train carers and on what to do, because you won't have a lot of input from physiotherapists. But it's back to this 80-20 rule. If he's wearing his splints 80% of the time, I would be happy. And wearing splints in the chair so that he's taking weight through the full weight-bearing surface, because often it can just be, part of your foot that's on, I'm trying to look at everybody's feet, part of your foot that's on the foot plate. And sometimes if your feet are a bit inverted, it can just be this part of your foot that's on the foot plate like that, and it can be quite uncomfortable. But if you're in your splint, it's dissipating the pressure throughout the whole of your foot. That also looks after the pelvis in sitting. Okay? Sorry.
Hi. My son's 23, and I would say 100% he has high sensitivity when you try and massage or manipulate at all. But now, this is a very specific question. He's just developed a DVT in his right leg from the groin, and he's completely swollen. So is there anything I can do to assist while the blood thinners do their bit? Or just don't touch it because it's really painful?
Is it really painful?
Yeah.
Okay. Again, I'm always guided by pain. I wouldn't ever push through pain or work through pain. It depends on the management in your area. Some areas are very specific when it comes to a DVT. They might look at the medication alongside compression.
Right.
So I don't know if anybody has spoken about a compression.
Well, absolutely
Stocking?
not. They said that's the worst thing you
to
could
do.
possibly do.
Okay.
He's going to see a haematologist locally.
Okay.
And Roz is going to have him in for a day's observation.
Okay.
and some of the American consultants said about these expanding boots that go on the feet.
Oh, yeah, yeah,
So I'm going to get one of those
So that's
bad boys.
like the Flowtron therapy, that's compression.
It, yeah.
So that's a form of compression. So it depends
Is that
on the
going to be
management.
painful, though?
Not necessarily, because sometimes it's with elevation as well, but again, some places will go against elevation.
Okay.
So what you have to do is, it depends where you are with the DVT
Well,
treatment.
it's literally only a week.
Yeah, okay.
ago.
You need to be guided by your
Yeah,
local
yeah.
area, because it will vary throughout the treatment process as well. So you need to be guided by your local area. I know.
It'll be a long process, I think.
I know, that was a shame. Sorry.
I have a lot of tightness in my jaw, and do you have any kind of exercises for that or anything like that?
Yeah. So that's tightness in the jaw, and that's a very common thing again that we see in many of our young adults with neuromuscular conditions. That can sometimes affect things like eating, because you can't open your mouth very far. It affects the chewing process as well. There isn't a great deal of work in this area, but I have had patients that have tried different things. One patient has a jaw jack.
Yeah, I've seen that.
Have you seen them? So you put it in your mouth and you can just gently it's like a stretch, if you like. So the same as we're talking about this passive stretch for the arm or the leg and holding it. It's a static stretch for the jaw, and it's a progressive stretch because you're gradually increasing it. It's a challenge when you go to the dentist and things like that, because you're trying to get your mouth open. I know. Do you have that as well, Mark?
Yes.
Yeah. Yeah, it really is. And even, your dental hygiene, everything is difficult. So this patient I have, she uses a combination. She's a different form of muscular dystrophy, but she uses a combination of the jaw jack. But what she's found is she has to use it, again, 80-20 rule, she has to use it a lot. As soon as she stops using it, she goes back to where she is, but when she starts using it, it improves. So she uses a jaw jack, and the other thing that she uses is the electrical, the TENS machine. So you know how you would use TENS machine for, you've got one, did you say, for pain? She has a very small TENS machine that she would use over her jaw, but again, that's something that you could have a think about, very, very low, because the face can be a bit sensitive as well. So that's something that some people have tried, but the jaw is definitely a difficult area.
Would you have to have a special TENS unit for the jaws? Would an ordinary TENS unit be too powerful?
Well, if it's turned down very low, it should be fine, because some of these, the machines that you tend to buy in the shops are never as strong as sometimes the ones that you would get out in the NHS anyway. So sometimes you'll see that they're turned up quite high, and then you accommodate to it, and then you turn it up a little bit more. So usually, if the ones that you buy out of Boots and things like that would be fine. So it's worth trying it, worth giving it a go.
How often would you recommend? Twice a day, 3 times?
Well, I would probably just say start with once a day and see how you go on, and then with the jaw jack as well, and just see if that stimulates. The jaw jack is, I think now I think it's the the people who do the facial, maxillofacial people. Don't know, I've never actually had to refer anybody there or anything like that, but I'm sure that she's got a referral from her GP. Your GP will be able to tell you, and that might be worthwhile. Okay. Does anyone have any other questions? Okay. Oh, yeah.
My head's getting further and further to the left, and I don't know what I'm going to do about my head twisting left.
Okay. And again, that's another quite a common thing that we see as you go older. It tends to be that you lean to, you have everybody has a preferred side, and you're stronger on one side. So it tends to be that you are, that's the side that you would migrate to. It's, again, we're back to always trying to be symmetrical. And if your neck is, if you feel you're going further over that way, you have to try and prevent the head from going further. So again, a really good headrest, but also starting to get people to come to you from the other side so that it's making you turn away from that side. So I would then approach you from this side which is difficult because you can't really,
Yes, that's right.
yeah, you can't see me as much. But if I'm starting off and then I would maybe come to the mid, so that you're starting to try and come round. Looking at you as well, I would be thinking about your pillow and how you're positioned in bed at night time. Now, do you always have your ventilator to that side? Do you ever have it on the other side? It's always to the one side. Okay, so again, so you're migrating that way, and this is probably your stronger side, and that's why you can see people better at this side, you can move better at this side. So it's about trying to go the opposite way a wee bit more, which you're out your comfort zone. But if you do always, it is worthwhile thinking about, if you're always approaching someone from the same to the side, that's always the side that you will migrate to. So always be symmetrical. Whatever you do one way, do it in the opposite way too. But I would say that we need to look at your positioning in bed as well with your pillows and things too. Yeah. Okay. I'm not even sure what time it is just now. Oh, it's 10:30, and I think this was for another 15 minutes. Okay, if there's no other questions, I mean, I was here just to kind of hopefully be able to advise and tell you what we do in the west of Scotland. I'm trying to think if there's anything else that people would come to clinic with. Oh,
I'll say one.
Okay.
Hydrotherapy, we've always found, oh no, you can't get that now, you're adult. Well, I just want to share a tip that how I got it from my son is I found, what you do find, there's actually more hydrotherapy pools for dogs than there are for boys. But anyhow, that aside, there are plenty of them in care homes. So I found one locally in Ewell to me.
okay.
It was about 40 quid an hour, something like that, and that included a physio and a pool attendant. And I got the bill, plunked it on the GP's desk, GP commissioning, well, commission that matey, and yeah, that's the way to do it. And he went through my Surrey Clinical Commissioning Board, just try opposing that. Got the consultant, got Ros to say, yeah, this is very, very beneficial therapy. It's a very cheap therapy, but it prevents scoliosis, it prevents you being chair-shaped. You know, what's not to like? But adults are so routinely said, oh no, it's not available. Well, don't have that for a minute. Don't have
That's
that.
excellent. I hadn't even thought of care homes actually as having pools.
Yep.
Well, that's a good tip for us.
Hydrotherapy, obviously, when you become permanently ventilated, it's possible, but it's quite a hassle.
Yeah.
So I guess that the question is, if you're permanently ventilated, is it worth going through the hassle? Is there benefits from hydrotherapy, or could you achieve the same result with physio?
Okay, you're absolutely right. It is the benefit of the hydrotherapy, and you rate that against how difficult it is. The benefit of hydrotherapy is that the water completely supports you, and in the pool you are able to do active movement. So you can do movement under your own steam because gravity is counterbalanced.
They all have hoists as well.
And they have hoists to get in and out. So you would be able to do more movement in the pool than you would be able to do on dry land. Now, on dry land, if you've got a very good carer, and perhaps you can move in mid-range, so you could move in that, and they can support your arm to do that, okay? And then they would take it passively to the end. So we talk about active assisted movement. So when I was working with you, I was doing completely passive movements. But if the young man can do some of the movement himself, allow him to do that. Because remember, we talked about these myokines. Well, different clusters of myokines are released with different muscle activity. So different clusters are released with passive as opposed to active. So if you've got active movement, no matter how small it is, it's really worthwhile doing that under your own steam because, again, it keeps your muscle working effectively and efficiently. We become deconditioned if we're not moving, and deconditioning is when your muscles almost forget how to do that contraction and relaxation process. They just slow down. So if you've got a very good carer, then you could probably mimic some of those movements, but you will never be able to get that same full stretch, that buoyancy that you get in the pool. And that floating, the actual feeling of floating is actually a very relaxing and a very therapeutic feeling. And in fact,
always make sure he has big bosom women to take him into the pool. He absolutely
Because do they pop their head?
And also they can get him standing in the pool,
Which you wouldn't be able to do.
So
Yeah.
so important.
So I would say if there was a possibility of being able to get into the pool, do it, okay? But you can still get very good physiotherapy on dry land as well. Okay, and it is a hassle. A lot of our boys will say it's when they come out of the pool, they get freezing cold, and that's a, you know, I
Not the ones we go to, because
Oh, you see, you're lucky.
People, the temperature's like tropical. Trust me.
Is it private care homes?
It is.
Okay.
Primary court in Yule Village, but there's so many of them around. You just got to look.
And I'm going to look into that actually in our area as well, just to see what's
And to be
available.
quite honest, it's underused.
Yeah.
Underused.
Well, the issue of keeping the ventilator tubes dry.
Yeah,
Yes, there is, but they have separate changing areas.
Yeah.
You know, every
Yeah.
home's going to be different.
Yeah.
But it's a flipping resource to tap into. Let me tell you.
okay. Any other comments?
Are there any exercises that can help you contracted hand?
For a contracted hand, yeah. That's just what we were talking about at the very start. Can I take this hand? Is that all right? So looking at the hand, I'm always kind of keen to see how far, how much movement there is, okay? And I would gently, there's not a lot, and I would gently take it, just keep working on it and just starting to take it out, because although you think initially there isn't a lot of movement, I'm actually feeling that's coming out a little bit more. It's coming out a little bit further, okay? And I would just stretch it a little bit more, okay? And take the thumb out. You would really need something soft, something inside the hand to give it that stretch and to give it that static stretch for a period of time. So that's the kind of thing that I would be looking at, is the movement. So even though you feel you've only got a little bit of movement, you've started that movement process. Have something within the hand that will stretch out. If it's too soft, the fingers will just contract around it. So it has to be soft enough that you can wiggle it right in under here, okay? But firm enough that it will maintain that actual movement here that that you've got. Can I suggest anything? We look at sometimes quite a high dense foam. So actually you can if you go to a foam shop, you can actually buy different densities of foam. So if you look if it's soft, if it's a very soft foam, it will just go in. But if you ask them for high density foam, it's enough for you to get it in there and just hold it out. The other thing is,
Sometimes you can use like insulating foam, you know. You put
yeah, actually that's right. That's a very good idea. So
That's such a brilliant point about foam shops, because if you buy these, you know, positioning things from an OT or a specialist, they're hundreds of pounds.
they are.
You go to a flipping foam shop, you carve it out with a knife,
Yeah.
Bob's your uncle.
Yeah.
Couple of quid.
And sometimes in the foam shops, they can actually do it for you. If you show them what it is that you want, yeah, because we've done that as well. Yeah.
We've got soft, fluffy socks that I sort of wrap round and bunch up into a shape of Vivek's hand, and it stays that way. And if I need it a little bit harder, put another sock in, because you've got plenty of them around.
Yeah, that's another good point.
And
The
that
socks.
really helps. Yeah.
That's excellent.
Diabetic socks that aren't going to be tight on your ankle.
Yeah, they're very good as well. And the other thing I would say is if you go and if you can get a referral to your orthotics department as well, very often they will make something bespoke for you that would just fit you. The thing about having something bespoke is you will then maybe need to go back in 3 months, because in 3 months' time you'll probably have a bit more movement. And if you're using the same thing, you're not capitalising on that movement. So you want to always make sure that it would be a slightly bigger. It's offering that stretch, because after a while, although at the start when I was stretching you out there and it felt, well, that's a stretch, within a few days it wouldn't feel like a stretch anymore, because you would have got used to it, and you have to feel the stretch to, so that you know that it's working. Okay. Any other points or suggestions? It's really good actually to hear what other people do. I've learned some things, so that's been really good. Okay. Well, I think it's coffee time. I'm going to be around for the rest of the day anyway, so if anybody thinks of anything.
Can I just alert somebody?
Uh-huh.
My sons play a pair of wheelchair football, and some of them struggle with the joystick, as you were mentioning about that. And there's a company called ergojoystick.com, and they do like 3D printing almost.
Oh.
They make like it fits your hand properly.
Get into the 3D printing workshop we've got.
Oh, that sounds excellent. So that's ergojoysticks.com.
Yeah, it's called ergojoysticks.com.
Okay.
American based. But Sophie's had one specifically made, so it fits over a joystick, and she's got her hand as open as possible there.
That's fantastic. That's a really good point. Ergojoysticks.com. I'm going to remember that. Thank you for that. Okay, thank you all very much. I'll be around for the rest of the day. No, I'm around, so if anybody thinks of anything, they think, oh, I should have asked that, I'll be here. It's fine. Okay, thank you.